Chemotherapy and radiation treatments can cause changes in the skin, and Skin Renaissance in Chesapeake is one of the few clinics in Hampton Roads that offers specialized skincare regimens for patients in cancer treatment. Here now to tell us more are Julie Trask. She's the owner of Skin Renaissance, along with Dr. Robert Schnars, a plastic surgeon at the Hague Center. Thanks to both of you for joining us today, and we're talking about skin treatment for people who are undergoing, like we said, cancer treatments. Now, Julie, why are the patients who are undergoing these types of treatments, why do they need specialized skincare? Is that necessary?
Approximately 1/3 of all patients who are undergoing chemotherapy or radiation will have some skin problems, either mostly dry, severely dry skin. They can have acne type of issues, but mostly dehydration, and then sensitivity to perfumes and dyes, and even things that they have used for years and years and years, they will suddenly
have a certain reaction.
Right, and because people who undergo chemotherapy and radiation are already immunocompromised, meaning their immune system is depressed, anytime you have an impairment on the skin, which is our first line of defense against infection, then that sets you up for further infection, which is what these patients cannot have.
Wow. And so there are certain things that they need to think about that they should maybe avoid, especially as they're undergoing these treatments.
Yes. Some things that they need to do is to make sure that you always have a sunscreen on, SPF minimum of 30, but 50 is better. You need to avoid long hot baths and showers. Don't use scrubs, loofah sponges, and the little scrunchy things. Absolutely avoid hot tubs. Lots of moisturizer, 2-3 times a day for moisturizer. Even simple things that people wouldn't think about, like don't rub dry, just pat dry.
Got it. All right, so doctor, can you explain the sequence that should occur when a patient is diagnosed with something like breast cancer, which you work a lot with, until they come to see you about reconstructive surgery?
Yes. Actually, you should try to put together your team as soon as you get your diagnosis made, because there's a lot of different players in the oncologist, the radiation oncologist, obviously your breast surgeon, your primary care physician, and the plastic surgeon, because that way you can find out what your options are. And there's no one way to treat this. And as Julie has mentioned, the skin is the biggest organ in our body, and chemotherapy affects all of those systems. And so how you take care of it during chemotherapy is very important. In addition to finding out, what your options are, the timing, and things like that.
Wow. And so if they opt for an implant, is that safe?
Yes, absolutely. And it's just like any other implant. There's no perfect implant. They're very safe, but you have to know their limitations.
Okay, great. And would it be a permanent thing, or is it something they need to have followed up and change in and out?
Well, there is no such thing as a permanent implant. Like you don't have a permanent pacemaker, you don't have a permanent knee replacement, etc. Implants wear out. There's nothing that's man-made that won't wear out. So permanent implant is really a misnomer. It's a long-term implant.
All right, well, that's some great information. Thank you for talking to us about that, and Julie for the skin treatments for people who are undergoing cancer treatments. That's great information. Skin Renaissance is at 312 Cedar Lakes Drive. That's Suite 103 in Chesapeake. And you can give them a call, make an appointment at 410-2833. They're also online. You can check them out at skinrenaissanceclinic.com. We appreciate you being here.
Thank you.
Thanks.